little video on how you would properly be doing a full mouth survey in the mouth whenever we're doing dental radiographs. So, firstly, we're going to want to start off with our anterior teeth, which would be our canines and incisors, both lateral and central incisors. We're going to be doing 3 maxillary and 3 mandibular of the teeth. And first one that we're going to start off with, here's my, this is my sensor right here, and this is my cord, and then I've got my, this is my PID, and then this is my little camera. So I'm going to be placing this on the maxillary right canine. Okay, and then we're going to be taking the photo, and then we're just going to be slightly moving it to get that picture. So we did the maxillary right canine right here. We took the picture, and then we're going to just slightly move it. We don't want to do a lot of moving. The less movement, the better. So I've got that in there, and then we're going to take our shot of the front, telling our patient that they're doing a great job. Then we're going to move it over, and we're going to end with tooth number 11 for this side. So we're on the maxillary left right now and getting the last of the anterior region over here. So I've got it right here on the canine, because these are central and our lateral, and so we've got it right over here by our canine. If it would stay in there for me. So we're going to line up our PID and take our shot. Next, we're going to be moving to the mandibular arch. So I'm just going to basically flip my thing over and start with the mandibular arch. And we're going to start with tooth number 22 because it's right here, because here's 22, 23, and 24. Tell our patient to close, and we're just going to take our shot. We're going to do as much little movement as we can. We're going to be trying to get in that picture of those central incisors lined up and take our shot. And then lastly, we're going to be wanting to get like over here by tooth number 27, which is our last canine on the mandibular arch. So we're going to line up our PID and take the shot. Now for our posterior teeth, we are going to begin with the maxillary right, because we're already over here in the mouth and the mandibular right. So we're just going to go to maxillary right. So what I'm going to do is I'm going to do my premolar shot first. I'm just going to tell our patient, open wide, get it in there, close down, and then we're going to line up the shot and take it. And that would be like tooth number 4 and 5. And then we're going to move back to our molar shot, which is going to be tooth numbers 1, 2, and 3. Line it up and take our shot. So then, while we're down here, I'm just going to basically flip it over, and I'm going to move to our mandibular left quadrant. And so I'm going to be doing exposure for tooth numbers 20 and 21. We're just going to be lining it up and taking our shot. And I'm just going to slide it back. And we're going to be doing tooth numbers, I think here, 17, 18, and 19. telling our patient to close. And back here, line it up and take our shot. And then I'm gonna be moving to the maxillary left because I'm up here at the time. I'm gonna expose my premolars, which would be tooth numbers 12 and 13. Just gonna have my patient bite down, not hard though. And then we're going to take our shot. And then I'm just gonna be moving back to molar shot 14, 15, and 16. Telling our patient to bite down, lining it up, and taking our shot. And then the last quadrant that we have to do is the mandibular right. So I'm just basically, because it's already set up for that, I'm gonna flip it over here and I'm gonna do my premolar shot. So I'm gonna be doing 28 and 29. And telling my patient to close, lining it up, and taking our shot. And lastly, I'm going to be moving back to 30, 31, and 32. Lining it up and taking our shot. Okay, and then the last thing that I wanted to go over in this video is where we would want to be getting the shot whenever we take them, and where we want to be lining it up at. So whenever we're doing a maxillary molar, we're going to want to get the first, second, and third molar if they have the third molar still present in their mouth. And then we're going to want to actually point from the corner of our eye to the mid cheek to get that angle. And then for the premolar, which will be the distal of the canine, the first and second premolar, and then it'd be kind of the mesial of the first molar. We want to get actually from the pupil of the eye to the mid of the cheek. So for the canine lateral ones, like whenever we, not the middle shot, but the canine and lateral incisors, we want to be getting, the canine and obviously our lateral, and then we want to be lining it up with the corner of our nose. Whenever we get the central incisors, we're wanting to get the mesial and the distal of the central incisors, and then we're wanting to be lining it up with the tip of our nose. Once we doing our mandibulars, we're kind of flopping back in the middle of fourth because you're going from one arch to the other whenever we're taking this survey. Whenever we're in the mandibular arch, whenever we're doing the central incisors there, we're still going to be wanting to get the mesial and distal of the central incisors and basically the mesial of the lateral. And then we're going to actually, for this one, we're going to be pointing down from the tip of the nose to the center of the chin. And then for the lateral incisors and the canine, we are going to be wanting to get the lateral incisors and then the mesial of the canine. And then we're going to want to point it down from the corner of our nose again to the center of our chin. And then for the premolar, we're going to be wanting to get, obviously, the first and second premolar, the distal of the canine, and probably be the mesial of the first molar again. And then for this one, we're going to be doing the pupil trick down to the mid-mandibular area. And then for the mandibular molars, we're going to be wanting to get all three molars in the shot. That's very important. And then we're going to be pointing down from the corner of the eye to the mandibular area to get that one shot. And then basically just for this is a pretty, I don't know. And then for the bite wings, we're going to be wanting to do all maxillary and mandibular crowns. because whenever we bite down, that's whenever we get the bite wing. So we get a little bit of the maxillary and the mandibular crowns, but we're not going to get the apices of the teeth, because it just basically gets the crown of your tooth right here. Same thing for the premolars. Basically, we're going to get the distal of the maxillary and mandibular canine, and then the premolars, and then the first molar if it's present, which it usually is. And then for all of those, we're basically going to be pointing down from the eye to the occlusal plane, which is, yeah. And I hope you guys enjoyed this video and that you were able to learn a few things about how to take a full mouth survey in the mouth.